Hi everybody, Jennifer Blevins-Smith with Integral Clinic Solutions, and you're watching my YouTube channel, Navigating the Business of Medicine. Today I want to talk about adding providers to an established practice. I've gotten quite a few questions on my credentialing videos asking about a little bit more information regarding adding providers to an established practice. So I thought I would just do a really quick video to hopefully help anybody out there that has the same curiosity and questions. If you want to add additional providers to an established practice, there are a few things that you just need to make sure that you do, and you need to be mindful that you cannot start having that new provider start seeing patients until you've received confirmation from the insurance companies that they are added to your group contract. A lot of people don't realize this, and they think when they initiate the credentialing or contracting steps with their insurance that they can just start seeing patients, and they can't, because their MPI-1, which is their individual MPI number, needs to be associated or umbrellaed under your group contract in order for those claims to be processed as in-network. You can do a few different things while you're waiting for providers to be added to your group contract. One is you could just have them see self-pay patients, because it doesn't really matter because you're not billing insurance. You could also tell patients that they're not contracted and give them an opportunity to pay cash for those services if they want to until they become part of your group. Or you just don't have them start working for you until everything is said and done with the insurance companies. Depending on your demand, your need, your workflows, your patient types, demographics, you'll have to make that decision that is best for you in your practice. So if you know that you're going to be hiring a new provider and you do the interviews and you decide on someone or someone's, multiple people, then the first thing you need to do is have someone contact those insurance companies and find out their credentialing status with those individual companies. Of course, this is assuming that they have worked elsewhere before and they have billed out for services to insurances. If they're fresh out of school, chances are they probably haven't gone through the initial credentialing process with any insurance, and then you would be starting from scratch. But either way, you would probably want to contact the insurance, give them the provider's full legal name and MPI-1 number. They do need an MPI-1 number. You can't do this without that. So if they are a new provider, they should apply for an MPI-1 number on the NPPES system before you start this process. And hopefully you ask if they have one during your interviews so that you don't have to delay this process any more than you have to. So you would want to call with their legal name and MPI number and find out their credentialing status and let them know that you want to add them to your existing group contract. Now, if they're already credentialed, chances are it will be an expedited process. They probably have a specific application for this situation, or they just ask for certain documents to be sent to them so they can process that. Sometimes they will say, okay, we'll add them to the contract first, but then they have to do the credentialing. It might be a little backwards, but nonetheless, you cannot have them start seeing patients until both the credentialing and the contracting is complete. So you want to give them that information as soon as you can. And if you've done this a few times already with your practice, chances are you probably already know what your different payers are going to require in these situations. But if it's your first time, I would be taking notes so that you can reference this at a later date if you're going to add another provider again someday, so that you kind of have an idea. So you want to submit all that information. Sometimes they'll also submit you kind of like a roster sheet that you'll have to fill out that they'll use for putting them under the contract. So you'll put their full name, their MPI, their DEA, all of that kind of information. They'll probably have you re-put the group tax ID number, the group MPI or MPI-2 number, so that they make sure they get all that correct under your contract information. Again, once all of this is taken care of, they will give you an effective date for that provider. That provider will be listed under your contract. It won't be a separate contract unless you don't have a group contract. Hopefully, if you are planning on adding more providers to your business, your practice, you already have an MPI-2 number, you have a group contract under the name of the practice, and you're not just billing out under your own MPI and social security number. You actually have like a tax ID number for your business and the MPI-2 number, and then they give you that group contract. All providers are billed out under that contract and they're reimbursed based on that contract. So again, remember that mid-levels oftentimes get reimbursed at 80% of the contracted rate instead of the 100% that doctors get. That's not all insurances, but it's most insurances. It's definitely your Medicare and Medicaids as well. So mid-levels do not get reimbursed or paid services to you as high as a doctor would. But also the overheads for hiring a doctor versus a mid-level is usually a little bit higher as well. So it kind of balances out. So you would need to decide what's best for you, whether it is good and makes business sense to hire a mid-level or another doctor. Again, if you are doing this, you want to start this process far in advance than when you're hoping them to start seeing patients, because it does take a while. Even if they are already credentialed with the insurance company, they still have to do a brief vetting or, like quote, background check on them before they will move them or have them added to your contract. It's not that simple, even though it seems like it should be. It doesn't go as fast as you would hope. Oftentimes, there are some small plans that it does, but I wouldn't take that for granted. I wouldn't assume that, and just assume it will take at least 3 months to get everything satisfied to get that provider added under your contract. Again, once you get that effective date, that is how you know that everything's good to go, and you can start having that provider see patients and bill out for services from that date forward. So those dates of service from the effective date on. Now, many insurances will not retro cover, so you would need to ask that up front when you're doing this process and you're contacting the insurance if they will retro cover any dates of service prior to their effective date. Sometimes Medicare will, sometimes Medicaid will, but commercial payers oftentimes won't, but it's really important you ask that. Also, something to note that if the provider is due for re-credentialing, so let's say they've worked elsewhere for a while, they have been credentialed with the payer, but upon checking their credentialing status, they're coming up on their re-credentialing, then they will say, well, we'll just do it a little early since they're due for re-credentialing and we're adding them to a new practice, so you will have to do their whole re-credentialing, and that can take even longer. You won't know until you call the insurance. So it's one of those things that just make sure that you're giving yourself ample amounts of time and you're not assuming it's going to be easy because they've been billing somewhere else with the same insurance. It always is new based on each practice or each business in which they're going to be working. If you have any experience with adding new providers to an established practice and you have some helpful hints or tricks that you want to share with your colleagues, please leave that in the comments below. Smash the thumbs up button if today's video was helpful, and subscribe to my channel if you haven't already. Thanks so much, you guys. Take care of yourselves. We'll see you next time. Bye-bye.